I'm Patty Miller. I'm the wound care nurse for the Copper Queen Hospital, and today I'm going to demonstrate how to apply a wound vac dressing, and we're going to bridge 3 wounds on this patient's body. We have one on the left hip, one on the sacrum, and a surgical incision site that dehisced on the right hip. At the Copper Queen Hospital, we use the KCI wound vac. There are a couple varieties. This particular vac is called the ActiVac. It's for home use. The one we use on inpatient is called the Freedom Vac. We also will need a canister that will attach to the vacuum, just clicks on. We will have a track pad with tubing that will connect to our canister tubing. We have drape, which we will use to secure our foam with. We also need a package of the Wound dressing, and these foam packages come in a variety of different sizes and shapes, but today we have the Wound, which is one solid piece. Inside the package of foam is the track pad that we've already applied and the drape for securing the foam to the wound. A couple other pieces that we will use today and aren't always used is white foam, which is much more dense than the black foam, and it's used in those areas that tunnel or undermine, that have deep undermining. They will not break off when you're removing them from the tunneled area. You can also use Adaptic over areas where there are bone or tendon exposed. The white foam is also sufficient for covering bone or tendon. Okay, so today what we're going to do is apply the different materials to the wound beds. So in this wound here on the left hip, we have a tunnel that measures about 2 centimeters. So I'm going to apply our white foam to that. And actually this undermining is not so severe, so we'll just use black foam over the rest of the wound bed and into this undermining area. This wound, normally we would make sure that the slough and the eschar is debrided before we apply a wound vac dressing, because you always want a nice clean wound bed when you're using a wound vac. It has exposed bone, so we will be using a piece of Adaptic, a non-adherent layer, to protect the bone. And also if there's tendon, we would use it for that purpose too. For this undermining, I will apply white foam to that, and we will cover the rest with black foam. And then in this wound bed, we have a nice clean, beefy red wound bed, so we will just be applying black foam to this wound. You can see that I have previously draped the peri-wound area to protect it if there's any black foam that overrides the edges of the wound. It will protect them from excoriation or skin breakdown. You want to cut strips to apply to the peri-wound area, and you want to get it right up to the very edge of the wound, all the way around. So I've done that already on the sacrum and the surgical incision site, and I have a couple more I'm going to apply to the hip dressing here. The drape comes in different layers, so you want to make sure that you're always pulling off where it shows one first, and there are 2 sides to the one. Then you're going to apply it, and then you're going to remove where it says 2, peel that off, and then peel off the blue. We also want to apply the drape to the areas where we're going to connect the wounds, and we bridge when we have multiple wounds and only one wound vac. So I'm going to run it from this wound to this one, and from this side to this one. Then we're going to put our pieces of white foam into the tunneled areas. So we're going to just cut a strip that will fit in them. And you can use a Q-tip if you need to push it into the wound bed. And then just cut off the excess, with some sticking out. Because you want to be able to remove it. It will compress, so it will shrink once the dressing's been on, but when you take your foam out, you will want to be able to get a hold of it to remove it. And then in this tunneled area also, I'm going to apply some foam to that. I'm going to put a piece of white foam into that undermining area. You can see that. And I'm going to cut a piece of adaptic and lay that over the wound bed to cover that exposed bone. So there you'll see the white foam in the tunneled area and the undermining, and over here as well. Then we're going to take our pieces of black foam, and I've already pre-cut some of these, but this is the way the foam will appear when you take it out of the package, the granufoam anyway. And I'm going to insert a piece here into the surgical incision. Let's see. And I have a piece here I'm going to insert. And sometimes you just have to cut, and so we're going to cover that. It's going to want to pop out a little bit. So what I'm going to do is go ahead and just run a bridge from one wound to the other, and the foam needs to be touching to for the vacuum to work when you turn the machine on. So a couple inches on each side of the foam. And then we'll fill the wound bed here with foam and drape these together to make sure that they're contacting each other. And it can be more than a couple inches to it. Again, it's so thin that it's very comfortable for the patients. I'm going to leave a little opening there so these two pieces can connect. And I like to cut a little bit smaller pieces. They're just easier for me to handle. Let's see, I'm going to do that. Turn this so you can see. And then we'll cover this last piece. what drape I have. So you can see that we've attached the wound on the left hip to the sacral wound and to the lateral hip wound here, and foam is all touching foam. Then we're going to cut a hole here in the large piece. Like that. And we're going to take our track pad. And you always want to think about the direction the track pad's going for the comfort of the patient. And I'm probably going to just run it along the side here. That's not going to suck down, I'm sure. I'm going to snip that and separate it, because if there's any air at all getting into the wound, our suction won't work. So on the track pad also there's a 1, and we'll remove that. And we're going to apply it, the opening of the disc right over the hole that I cut. And peel that off. Okay, now we're ready to start our vac and see if we have good suction. If not, we will add more drape. I'm going to turn it on. We're going to hit OK and the on-off. So I'm going to need to find the leak. There it is. You can see the sponge compressing, and that's how you apply a bridged wound vac dressing. We normally change the entire dressing every Monday, Wednesday, and Friday, or depending on when you start, 3 times a week. It's usually every 48 to 72 hours is the normal protocol. Every time you change the dressing, you will document the condition of the wound. The measurements, again, in the photographs are only done once a week, but always there will be documentation about the condition of the wound and exactly what you applied, how many pieces of foam and what color will go in your documentation. The wound vac settings are to be found at the bottom center of the screen here. The usual setting is 125 millimeters of pressure. If there's excessive drainage and you need more pressure, it can be increased to 150. Or if a graft has been applied and you want a lower pressure setting, you can decrease it to 75 or 100. And there are settings on here that can be changed. And KCI is more than happy to help you know how to get in and change the settings if you just call them. There are 2 different settings as well, called continuous and intermittent. And normally we will keep someone on a continuous setting. The intermittent tends to be much more painful, so it will run for 2 minutes and then it will be off for 5 minutes. But every time it kicks back on, it creates this suction for the patient, and it causes a lot of discomfort. So continuous is the normal setting that we use. So here we've completed a wound vac dressing change. I'm Patty. I hope you enjoy the skills fair this year.